I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thank you for joining us for today's procedure. Our guests are cardiologists Dr. Carlos Ince and Dr. Kate Elfrey of the Heart Center at Mercy. Okay, first a little background. Where did each of you grow up?
So I grew up in Baltimore, born and bred. I'm a homebody, so I stayed in Baltimore for most of my life. Went to Mercy High School, so I've been a Mercy girl for many years now. And then went to Loyola for college, and then just moved away for medical school. Went to New York for medical school, and then came back to Baltimore to do my training here, Johns Hopkins Bayview for medicine, and then University of Maryland for cardiology training.
Oh, that's awesome.
Yeah.
My sister went to Mercy High, and I'm a graduate of Loyola College myself, so.
That's wonderful.
So we're both Greyhounds.
Yes. Yep. Greyhounds.
Dr. Ince, how about you?
So I grew up in a small town in New Jersey called Sayreville. Sayreville is famous for creating one John Bon Jovi, who grew up around the corner from me. In fact, I was classmates with his younger brother. We moved to Florida when I was in high school, so I graduated high school in Florida, and just outside of Orlando. I went to college at Yale. And then I moved to North Carolina to do my med school at Duke, so I am a Blue Devil. Most people in Maryland don't like that.
Let it fly.
And after finishing med school, I came to Hopkins to do my training. I was only supposed to be there for 3 years, and 20-something years later, I'm still here in Baltimore.
Wow. Now, is medicine something you both always wanted to do, or it's like, you never thought you were going to wind up becoming a doctor? What's your thoughts?
So I grew up with a father that's a cardiologist, and he's actually here at Mercy, Dr. Planholt. Mm-hmm. And from the time I was a little girl, I always wanted to be like Dad, big time daddy's girl. I think the first time I shadowed him in the hospital, I was around 10 or 11 years old on Take Your Daughter to Work Day. Mm-hmm. And I got to watch him in action in the cath lab and taking care of patients. And I was hooked from that moment on. So I always knew that I wanted to go into the medical profession. I wasn't exactly sure what field I would choose, but I would say that was my driving force for going into medicine.
How about you, doctor?
So up until I was about 7, I wanted to be an astronaut. Oh. Okay, that was at the time when Apollo and the moon landings, and everyone was drinking Tang and blah blah blah. So around 7 or 8, we had a family event that changed. My younger brother, was very ill and was in the hospital for maybe 2 weeks. So I spent a lot of time in the waiting room, and I got to watch, the doctors and nurses going back and forth. And I was so worried and concerned that he wasn't, I was going to lose my younger brother. And after, he came home and he's perfectly fine, I realized at that point that that's what I wanted to do. So ever since the age of 7, I knew that I wanted to be a physician.
So do you still find that desire to not actually become an astronaut, but at least follow the space science world?
I really am fascinated by it. Every time my wife, kids me all the time, because every time there's a launch or whatever, we'll definitely try and tune in, and I try and keep in touch. But I think it's very fascinating.
Now, Dr. Ince, I see you served a 2-year term as the president of the Association of Black Cardiologists. That's an international organization. Yes. With a mission to eliminate healthcare disparities in underserved patient populations. Tell us about your work in that regard.
Well, it's interesting. When I was a fellow, I really joined the organization really for mentorship. What a lot of people don't know, there are not a whole lot of Black cardiologists here in the United States and abroad. So looking for role models who are like you, it's kind of hard to find. So I joined the organization, and once I, joined the organization and got the mentorship I needed, I really started to learn more about the basis and the foundation of the organization for looking at healthcare disparities. If you look at just across the U.S., particularly in a city like Baltimore, there are drastic healthcare disparities, especially in cardiology with African Americans. We were involved in a study looking at, how likely is it for an African American with similar symptoms to a non-African American that comes in with heart failure to get a cath. And it was amazing with the great hospitals here in Baltimore, there's a huge disparity in the percentage of folks that get cathed with the exact same issues. So these disparities exist, and this organization is really trying to work with the ACC and the American Heart Association to address these, educate not only physicians but patients so that we can narrow these healthcare disparities. So it's really become really a lifelong work. Even though I'm no longer in the office of the presidency, is still are very interested and very active in trying to look and identify these disparities and try and see if we can reduce them.
Mm-hmm. In accepting the role in 2008, you mentioned Dr. Martin Luther King and his quote, "Of all forms of inequality, injustice in healthcare is most shocking and inhumane." Why did you select that quote? Why was that of particular significance to you?
Well, first of all, Martin Luther King is someone who I admire. Even though I was very, very small when he was assassinated, I feel like very close kinship with him. And that particular quote really summarizes what we are experiencing here across the country. These healthcare disparities for something as basic as, good pharmacy access, healthcare access and so forth, really shouldn't be as disparaged as it is, based on race. And unfortunately it is.
Dr. Elfrey, I sometimes go online, I like to go online and see what patients have to say about Mercy doctors. Now, in your case, one patient described you as, quote, "the gold standard for cardiologists." He noted you have, quote, "the extraordinary habit of listening intently to her patient." Now, I find this pretty fascinating, as I've heard, many doctors tell me that their number one concern that patients have is that they're not going to be heard. So why do you think that is, that patients feel that they're not going to be heard?
Well, first of all, it's a very kind comment to whoever said that, so thank you for that. I think that as physicians, I can speak from the physician side, that we feel a time crunch, not just when we're in the room with the patient, but in general, in trying to balance work, life, and be good at what we're doing and be efficient with our time. And so I think that has kind of developed into having not as much time as we would ideally like to spend with our patients to really get to know them, to listen to them, and to try and get to the root of what's causing their main issue for why they're coming in that day. I remember learning when I was in medical school, there was a study done where we spoke about, how much time do you think it takes before when a physician walks into a room, before the patient is interrupted by the physician. And the time in this study was 11 seconds. 11 seconds of a patient talking and trying to explain while they're there before they were kind of interrupted or cut off by the physician. And so when I learned about this, I was like, okay, I'm gonna do everything I can to intently listen and not interrupt, and just see what I can learn from that and gain from that. And also, I think I could say on the flip side, being a patient myself in the past, because we're all human beings, we're all patients, it is kind of a tough experience when you walk into the room with lots of questions and you want to share everything, and you might feel like the doctor's not intently listening to you. So me personally, I just try and sit and listen. I'll always ask my patient, so what brings you in today? How are you feeling today? And just let them talk. And sometimes that turns into, just a minute of XYZ is going on, and otherwise I feel fine. And sometimes it turns into 15 minutes of, my brother just passed away and my anxiety levels are through the roof and I'm having all these palpitations and heart symptoms. And so I've learned over the 10 years that I've been doing this that if I hold myself back and take the time and intently listen, I will gain a lot in the long run and learn more of the root of the underlying problem and be able to truly help heal the patient, not just maybe for whatever exact physical complaint they're coming in for that day, but more of a mind, body, spirit, whole body level.
Dr. Ince, I want to turn to you. Can you tell me about, and I'm going to butcher this, transthyretin amyloid cardiomyopathy, or ATTRCM, and why it's a condition you want every patient to be aware of?
So it's actually very interesting because it's the common term for that is amyloidosis. And we've known about amyloid for a long time, and we know that it can affect the heart. What we've found out recently is that there is an inherited form of amyloid that disproportionately affects African American and especially folks from the Caribbean. And it's difficult to diagnose. There's recently a drug that has come out that people are using, and it's created almost a renaissance, if you will, for one, identifying it, and now that we have a treatment of trying to address this for these folks. So the drug company that makes it had approached me to be a speaker, and I've had a couple of seminars that we've done in the past year, basically with churches and other groups that are primarily African American, and especially if they have a Caribbean population, to try and educate these folks that if you have certain symptoms, you probably need to just touch base with your doctor. We're speaking to the physicians so that they're more aware that they can test folks and that there is a treatment for it. So, it's one of these things that's evolving at this time.
Dr. Elfrey, what's the inactivity trap?
I love how you do your homework, Dan. That was digging way back, and I love that. So the inactivity trap is an article that I wrote back when I was studying internal medicine, doing my training at Johns Hopkins Bayview. One of my mentors there was very interested in, a cardiology mentor, very interested in the connection between the diagnosis of heart disease, coronary disease, and then the risk for developing depression, and in particular, sometimes depression and anxiety. And with the research that we were doing, we very clearly saw that there was a link, without a doubt, that patients who have had a heart attack or who are diagnosed with coronary disease or have had a heart catheterization that shows a blockage in the arteries become, inevitable, without explanation, understandably, will become hypervigilant to their symptoms and what they're feeling. And sometimes this can create a sense of anxiety. And then also being diagnosed with a chronic illness can bring on kind of the sense of heaviness or depression. And so where the inactivity trap comes from is, what many people know is that if you have a diagnosis of depression, it's oftentimes harder for you to motivate yourself to exercise, right? You might not have the energy to do so. You might not have the desire to do so. It takes a lot more kind of motivation to get up and go and hold yourself to a regimented exercise plan. Now, if that happens in a patient with a diagnosis of heart disease, this becomes a major issue, right? Because as cardiologists, we want our patients to be active, and we know that living an active lifestyle is what's best for them, and we know that's going to help them in the long run. So the inactivity trap was kind of my take on how do we help get these patients out of this catch-22, right? Where they get a diagnosis of heart disease, and then they might be more at risk to feeling down and not have the motivation to get up and exercise, but yet we are asking them to exercise for a minimum of 150 minutes a week. And if they don't, then this can negatively impact their cardiac health.
Well, I think it's very interesting because I've been hearing this from other doctors as well, this connection between a patient's mental health and their physical health, which kind of plays into what you've been talking about in terms of treating the whole patient, because the brain, the mind, the spirit, the body, it's all one package.
Yep.
They're not in little plastic bags all separate from each other. They all relate together. And in my mind, that's a trend that's been a long time coming, and glad to see it. But now that we're actually seeing research and studies that are coming out that are indicating these things.
Without a doubt. I mean, I have some patients who have minimal risk factors, textbook risk factors for heart disease, but are under a tremendous amount of stress. And they're diagnosed, we find out that they have, buildup of plaque and blockages in their arteries. And I think that it is crucial to get to the root of the stress when we notice someone's under a lot of stress, which, let's face it, all of us are under a lot of stress. I don't think we're being honest with ourselves if we're not living through a global pandemic and having a million things change and responsibilities in our lives. So making that connection as a physician, for me, is something I will do with every patient. Ask them how they're feeling emotionally, how are they dealing with their diagnosis mentally, trying to help them recognize that, it's not your fault if you're feeling down or if you're feeling more anxious, and we can help you.
We'll take a break, and we'll be back with more Medoscopy.